Rajan, sir.
So, good afternoon. My presentation is on torch infections and insight into pediatric cataracts. There are no financial interests for this purpose. So, congenital cataracts, they significantly impact visual development and they often lead to amblyopia, strabismus and long-term visual impairment. They are substantially more challenging than senile cataracts and they pose a huge financial and psychosocial burden on the affected families. Developing countries like India have a high incidence, almost 5 to 15 per 10,000 live births, which is twice, 2 to 3 times as compared to developed nations. The various etiologies include infections, metabolic causes, familial cases, trauma, and intrauterine radiation exposure. So, torch infections, they attribute almost 20 to 35% cases of congenital cataract according to different studies. And routine vaccination is performed only against rubella. And the burden of disease caused by the various torch infections in a differential manner will help in planning better implementation of existing resources. So the aim of the study was to estimate the proportion of various torch infections associated with childhood cataracts presenting to a tertiary care center in eastern India. It was a hospital-based cross-sectional study. Duration was from January 2022 to January 2024. The study population consisted of patients with cataract aged less than 18 years presenting to the OPD of AIIMS Patna, and the sampling technique was purposive sampling. So, total number of patients who presented to our OPD under the age of 18 years with cataract were 129, and cases of traumatic and secondary cataract were excluded. We were left with 38 patients, out of which 8 were lost to follow-up, and the final number of patients included in the study was 30. So, chemiluminescence immunoassay CLIA was performed for rubella, CMV and toxoplasma, whereas ELISA was performed to test IgM antibodies against HSV1 and HSV2. So the results included the mean age of the presenting population was 4.6 years, and it ranged from 4 months to 14 years. There was a high preponderance of male subjects, almost 70%, and most of the cases were bilateral, 93% out of 30. So, as this graph shows, most of the patients, 23 out of 30 children, they tested seropositive for antibodies against IgG antibodies against CMV, whereas 13 tested positive for IgG antibodies against rubella, while only 2 tested positive for IgG against toxo, and none of the patients they tested positive for HSV, IgG or IgM. So high rate of presence of IgG antibodies against CMV indicates high rate of previous infection, and Singh et al. In their study found that almost 33% of childhood cataract cases tested positive for torch infection, while in our case almost 25 out of 30 patients, 83% patients tested positive for antibodies against one or more torch pathogens. And in a study conducted by Das Gupta et al., 91% tested seropositive for one or more torch pathogens, so which was also seen in our study. The limitations of this study being it was a hospital-based study with a small sample size which might not be representative of a larger population, and qualitative serological assessment of antibodies against torch pathogens was done, while quantitative trends of antibodies would have been a stronger predictor of infection. So the take-home message here is the high rate of seropositivity against CMV in childhood cataract cases presenting to our center may be an indicator of larger role of CMV in certain populations, and larger population-based case control studies are needed. Though larger population-based case control studies are needed to establish causation in these populations of actually CMV causing congenital cataract in these populations, we need to conduct more studies to actually establish a cause-effect relationship and implement resources such as vaccination or medical management in pregnant women to reduce the incidence of congenital cataract in these patients.
What is the difference in the post-operative outcomes that you have observed in those groups which had positive and the others?
We did not, in this study we did not compare the post-operative results, but
How many of the kids received
because only 2 tested positive for CMV IgM. IgG was present in 23, only 2 have tested positive for IgM, so only 2 received therapy.
But do you think that CME is that common in other places? Is it the population you have tested is from
From Bihar.
Bihar, na? So is it something, there's something to do with some endemicity with this CME? Otherwise we don't find that much toxo, you can say, or others. But CME, I don't think that is that common. That did you search
We
for
were
the
expecting, yes ma'am, actually seroprevalence against CMV is high in many parts of the country, including there was one study conducted on women of reproductive age group, so, and children also. There was a different study which was conducted on children under the age of 18 years, and in both the studies the seroprevalence of CMV was almost as high as 80%.
How many of them had maternal positive history of xanthomatosis fever in the antenatal period?
There is a recall bias in such cases, so only 3 or 4 mothers they said that they had a history of rash.
They had.
Yes.